Who is the WHO? Hello, this is Reinhard von Hennigs. No, it's not who is who, it is who is the WHO, as in the World Health Organization. Traveling between Europe and America and being in both parts for business, I see that different countries and different regions of the world have the tradition of either using acronyms and then spelling it out, or just trying to make a word out of it. So WHO in one part of the world, WHO in the other part, is still the same, the World Health Organization. It is an agency of the United Nations, and in the current times, what I feel is relevant is that the United Nations agency, WHO, has implemented the International Health Regulation, which is binding for the 194 signatory states of the WHO. 194 states are under the binding governance, plus Liechtenstein and the Holy See. If you never heard of Liechtenstein or the Holy See, you may have heard of the Holy See as in the Vatican, which is the same but just a different spelling of it, and Liechtenstein is a little dukedom in the middle of Switzerland. So for those 196 nations, whatever binding regulation comes out of the WHO with regard to global health is relevant because it is the local law. It was established shortly after World War II in 1951 as a method to stop global spread of diseases. And in the current times where we see diseases being spreading, it is even more meaningful. However, the overall problem of United Nations and United Nations agencies is that it appears that the lack of enforceability, the lack of enforcement, creates a certain void. Whether this will lead in the future to more spreads, whether we should have more enforcement branches to governmental or supranational agencies, is all a different question. It's not the question of today. Today's musing is about the WHO, and now you know who is who.